The most dangerous blood pressure as you get older is not always a high one. Sometimes it's a normal one because the targets that most doctors are using for optimal blood pressure were actually designed for a 40-year-old, and aiming for 120/80 as someone who is 60 or older might not be keeping you safe. For some of you watching this video, it may be doing the exact opposite. I am Dr. William Lee. Today, I want to show you exactly why that is and what your true blood pressure target should look like as you age. And by the end of this video, I'm going to share a significant finding, something fairly new that I think every adult over 60 on blood pressure medication genuinely needs to hear. Let me start with what actually changes inside your blood vessels as you age, because understanding that critical piece changes everything about how this number should be interpreted. Most people think blood pressure is simple, that high pressure is bad and low is good. That's the end of the story. And when you're younger, that's often true. But once you move into your 60s, 70s, and 80s, blood pressure becomes far more complicated than most people realize. And here's why. Your blood vessels change structurally as you age. They become stiffer, less elastic, and less able to react quickly to changing demands in the body. The stiffening blood vessels push blood pressure higher over time, which is part of why blood pressure tends to climb with age in the first place. But here's the part that matters even more than that. That same stiffness makes your body significantly worse at adjusting blood pressure moment to moment, especially when you stand up, when you're dehydrated, when you're hot, or when you have not eaten enough. This phenomenon is called orthostatic hypotension, and most people experience a mild version of it without realizing what it is. You stand up too quickly and the room goes hazy for a second, or you get out of a hot shower and suddenly feel lightheaded. This is your blood pressure regulation system not being able to catch up with the body's demands. In a 40-year-old, that may mean just having dizziness for about 1 to 2 seconds. But in a 75-year-old, it can mean a fall, a hip fracture, a head injury, and in some instances, a complete loss of independence. And this is the part of the conversation that current medicine does not explain well enough. We spend years correctly warning people about the dangers of high blood pressure, the strokes, the heart attacks, the kidney disease. All of those things are true. But what gets left out is that in older adults specifically, overtreating high blood pressure can often be more dangerous than the blood pressure itself. Now let me break this down for you in a real-life situation. I think about 2 different patients that I've personally seen, both around 75 years old, and both with blood pressure readings in the same range. Let's say each of them have a blood pressure reading of 142/92. One of them is still active, walking regularly, gardening, sharp as ever, tolerating medications well with no symptoms, no falls, dizziness, or balance concerns. For that patient, treating a blood pressure of that 142 genuinely reduces stroke risk over the next decade. The vessels in their brain, their kidneys, their heart benefit meaningfully from that lower number, and their body has the resilience to tolerate the medication without the regulation struggling to keep up. But take patient B. This patient's more frail, already managing several chronic medical conditions, struggling with balance, trying to lose weight, and getting dizzy when standing up from a chair. From that patient, aggressively pushing their blood pressure closer to 120/80 could do far more harm than good. Every additional point of blood pressure reduction increases the odds that their already struggling regulation system cannot keep blood flowing to the brain fast enough when they stand up. The medication that helps patient A live longer can be the same reason that patient B ends up on the floor. It's the exact same number on the cuff, but 2 completely different risk profiles. This is honestly the part that genuinely concerns me as a primary care provider about how these blood pressure guidelines are supposed to be used in practice. In many of these blood pressure studies, the exact patient B that I was talking about before tends to be excluded from the blood pressure studies which create these guidelines that we have today. This is the single biggest reason that a one-size-fits-all for blood pressure makes absolutely no sense. Now, before we get into what your target should be, if this is already starting to change the way you view blood pressure, please consider subscribing, as it really does help push this information out to the people that genuinely need to hear it the most. I'm trying to change the way that we approach blood pressure in medicine instead of just pushing more pills. And every subscribe helps to achieve that mission. Now, I want to be clear about something before I give you an explicit number. There is no single perfect target that can be applied to everyone over the age of 60. Anyone who tells you otherwise is giving you a guideline, not a specific answer. If you're over 60, generally active, and tolerating your medication well without symptoms, aiming for a systolic blood pressure below 140 makes sense. Sometimes closer to 130 is reasonable and well-supported target for someone in that category. But if your treatment's making you feel dizzy, weak, foggy, or unsteady, or if you're experiencing any falls at all, if your blood pressure drops noticeably when you stand up, that conversation changes completely. At that point, your symptoms are telling you something that the number on the cuff is not, and your symptoms should always win. If you are this specific patient, your blood pressure target may not be able to go down into the 130s. Your systolic reading may have to stay in the 140s, so you're not getting dizzy, you're not having orthostatic hypotension, and you're not at risk for significant falls. That is okay. Now, before we go, I want to give you a simple test that you can use at home to measure whether or not you actually have orthostatic hypotension. First, take your blood pressure while sitting down and record that number. Wait 2 minutes, then stand up and take your blood pressure again within 1 minute of standing. If your systolic or the top number drops by more than 20 points, or your diastolic number drops by more than 10 points, and you feel any lightheadedness, that is orthostatic hypotension. Bring that specific finding to your doctor. This does not mean high blood pressure doesn't matter. It absolutely does. Untreated hypertension silently damages blood vessels for years and genuinely increases the risk of stroke, heart attack, heart failure, and kidney disease. But it's a genuine argument that you have to weigh this in balance with the symptoms you're experiencing, especially if you have orthostatic hypotension. If you want to lower blood pressure naturally, I've linked all of the supplements that have been known in the evidence to truly lower blood pressure. Many of them in combination can do so as much as prescription medications. If you're interested, you can check out all 5 of those in the link below. Finally, if you want the complete plan to how to lower blood pressure naturally, it goes so much deeper than any video ever could. I put all of that together in my free resource called the Blood Pressure Blueprint. You can grab that completely for free using the link below. In my next video, I talk about the single best way that older adults can lower blood pressure naturally. So if you want to get off your prescription medications, you're going to want to check that out right here, music.